Medical tourism thrives in Nigeria among leaders, politicians and the wealthy class. Traveling abroad to seek medical treatment in the face of crisis in the nation's health sector, poor primary health care system, poor facilities, brain drain and disease outbreaks, why those who cannot afford to travel resort to either miracle or herbs.
The issue of remuneration, issue of lack of progressive in their chosen career, lack of security threats, and the issue of not having access to sophisticated equipment or latest equipment to work with, like as you said earlier. And it's only medical tourism that can bring all these things they are liking. Is it money, they should inject zero. Even the government inject budget for Nigeria for 20 years in health sector, it will still remain the same without embracing medical tourism.
The goal of having a healthcare facility is to provide available and affordable care for everybody. It must be available and it must be affordable. If it's available and it's not affordable, people will go to where it is affordable. That is why people are streaming to India, for instance.
Nigerians are sick. There are no bed space. And when they go to private, they can't afford it. Now, where they will go is teaching hospital, where it is cheaper. The place, no bed space. The structure has decades. Mongo Park has not been expanded. And population is growing. It's a big issue. Funding is key.
However, Nigeria is spending about $1.5 to $2 billion annually on medical tourism. This has been a drainpipe to the country's valuable financial resources and underscores critical gaps in its healthcare system. Failure of the successive administrations to improve healthcare systems in the country and reverse the trend of medical tourism has continued to exert financial burden on the average Nigerian who needs a high level of care. However, this medical conference, organized by All Africa Medical and Wellness, seeks to provide solutions and tapping into the numerous benefits of inbound, outbound and intrabound medical tourism, which will attract investors.
Who investors will come to where there's no business to come and invest in time? Investors look at three things. The number one thing investor will look at, if business is viable, they look at, is their capital going to be secured? Is the return on investment guarantee as at when due? All the things, these things, no wise in our health sector, because day in, day out, our hospitals are winding up. Many doctors are closing down their hospitals and running from this country in good numbers.
We have seen 93 Nigerians through the last year, and we've served them well, and they came back home in good health. And it grows up the awareness where we can help Nigeria as much as we're helping them in Egypt. We can also help them over here.
The government also needs to look into healthcare as a business. When we see healthcare as a business, it will help us to open our mind towards medical tourism and also invest more in our hospitals in terms of infrastructures and equipment.
Experts say building trust in local healthcare system with the right infrastructure and enabling environment, investors will be encouraged to develop the sector and Nigerians will begin to see the possibilities of receiving affordable and quality healthcare. In Abuja, Stella Carlo reporting for True Vision Online Television, the platform that democratizes the media space.